suffixes to memorize. Suffixes are found on what part of the term?
The end.
At the end. Okay, that's the first thing you actually look at whenever you try and figure out what the term means. Okay, so these first three mean the same thing. They're all just descriptive. They add a descriptive nature to the term, make it like an adjective or an adverb. So AC means pertaining to, like cardiac would be what? Pertaining to the heart. Okay, or ooh, that's IC. Oh no, I can't think of another one right now. I'll come back to it. AL means pertaining to as well, like cervical, which is what?
Pertaining to the neck.
Yes, pertaining to the neck. Sometimes you can have plural. You remember what pleura is? It's on your body. Person. That's pertaining to the lining of the lungs. Anyways, IC is also pertaining to, like gastric is what? Pertaining to the stomach. Otic, what would otic be?
Pertaining to the ear.
Pertaining to the ear. Or, no, I haven't had ophthalmo yet, have we?
Geriatric.
Geriatric, pertaining to elderly treatment, right, good. Okay, algia is painful. So if I said arthralgia, what would that be?
Joint.
Pain in the joint. Okay, gastralgia would be what?
Pain in the stomach.
Yeah, I'll stop here. Okay, seal is a hernia. So, one example, a cystocele would be what?
A hernia in the cell? No.
Not cell, in the bladder, yes, a herniated bladder. So, yeah. I'll show you guys a picture in a minute, but have you ever heard of an omphalocele? I can't remember what omphalo is right now. But an omphalocele is actually where a newborn or a baby is born with, they have like this kind of hernia, it's kind of a sac out of their belly, and it actually has abdominal organs in it, but it's outside of their belly.
I want to see it.
I've seen that on Facebook.
I hate when people like them pictures.
But they're like,
I do not want to see that.
I see that on that.
Yeah, but
I'll
most
show
of the
you
time people
one.
don't really like that stuff.
I can't remember what omphallo means though right now, it's bugging me. Oh, and of course it's not in here right now. Well, anyways, I'll figure it out later. But yes, that's what it is. It's just, a seal is a hernia, so they can be in many different places. Typically a hernia, do you know what a hernia is? Hernia is just where an organ that should normally be on the inside of your body pushes through like muscle tissue, and it like is outside of the muscle tissue. Like it happens a lot with intestinal hernias, especially if people have surgery or something. Sometimes their actual intestines will push, not through skin necessarily, but through the abdominal wall, so you can actually see it. You may have seen babies before with an umbilical hernia, where that part of their intestine actually comes through their belly button, and so it'll kind of make the belly button stick way out. But it's it's usually pretty simply repaired. It's just a pretty simple surgery.
My friend's babies, or whatever, had a diaphragmatic hernia.
Oh, a diaphragmatic hernia.
He died.
Yeah.
What's that?
Yeah. I'm not, I think I actually know what you're talking about, but, or who you're talking about?
I mean,
I can't think of how exactly that, all abdominal organs had gone through the diaphragm. Yeah. Sometimes people have like a stomach hernia where actually part of the stomach, just the stomach, not all the abdominal organs, but push up through the diaphragm and end up on top. That cause, that requires surgery and stuff too. So that's all a hernia is, though. It's where it's come out of its normal place. A lot of, sometimes it can happen in the groin too. Where am I? Centesis. It's a surgical puncture to remove fluid, and it is like what it sounds. They put a big needle in, they pull fluid out. So they could have a thoracocentesis. What would that be?
No, thorax.
The thorax or the chest. So maybe they have fluid like around the lining of their lungs. That could be a reason they would need to do a thoracentesis. Maybe around the heart. Yeah, not a comfortable procedure. They can do amniocentesis. You want to know what amniotic fluid is?
No.
I've heard that.
It's the fluid around the baby in the mother's womb. So if an amniocentesis is usually done if they are not sure that they think that something may be wrong with the baby, or there's some kind of genetic problem with the baby, or if the mother is older, a lot of times they'll do an amniocentesis if they choose to do that. And they actually take a needle and they pierce the belly and pull amniotic fluid out to test it, because amniotic fluid actually has DNA and cells in it that actually, they can look at the genetic, see what's going on with the baby that way, look at their chromosomes and all that. Interesting. That's usually when you see a centesis. Thoracentesis or amniocentesis are the two terms that I've heard that used with most commonly, but anyway. Okay, ectomy is removal of something. So a hysterectomy is what?
Their female part.
Well, it's the uterus. Hystero, remember, means uterus. It's on your person. You can have a gastrectomy. Part of your stomach is removed. A colectomy. You can have a lobectomy, which is usually part of the lung, like one lobe of the lung. You can have all kinds of ectomies. Appendectomy. It's what? Appendix. Okay, so ectomy. Make sure you make a note of that, because we're going to learn one later this week that looks a lot like that, but that ectomy, that EC at the beginning of this suffix changes the meaning. That means removal of. Look down at the bottom where it says otomy or tomy. I really shouldn't have put that O on there, but where it says T-O-M-Y, that's an incision into. Okay, not the same thing. Removal of an organ is not necessarily the same as cutting into it. So tomy is cutting into it or an incision into, and an ectomy is a removal of. Okay. Does that make sense?
Mm-hmm.
Okay. So make sure you pay attention to that. Anemia is a blood condition, like anemia is what? What does A or N mean?
Negative.
Negative or without. So literally means like condition without blood, which it's not that you don't have any blood, it's just that you have a lower amount, or it doesn't carry as much oxygen as normally would. What else? Leukemia. We haven't talked about leuco, but leuco means white. So leukemia literally means abnormal condition of white blood cells. Add that in, but that's what it is, white blood cell problem. All kinds of stuff. We have, polycythemia. Any ideas on that one? Anemia is abnormal condition in the blood.
Many.
Poly is many. Cyte.
Cell.
Cell.
Any blood.
So, too much blood. Polycythemia.
You can have too much blood.
Mm-hmm.
I don't know that.
And overproduction. That can be a result of some kind of cancer. Like leukemia would be some kind of cancer in the bone marrow where it's overproducing red blood cells. Itis is inflammation or infection. You've learned that, right? Arthritis is what? Inflammation of the joint. You could have gastritis, enteritis, appendicitis.
I'm still on the interim, like that's intestine.
I watched her.
What else?
I want to know why you went to the office for that position.
Pneumonitis. I don't know if pneumonitis is actually a term. Pleuritis. That's a term. Pleuritis is the lining of the lungs. Inflammation. Okay, genesis or genic means producing or forming or creating. I always remember this because I think Genesis in the Bible is the creation story. Or if you generate something, or that's how I remember it. Anyway. Osteogenesis would be what?
Yeah.
bone formation, process of bone formation. Or sometimes you'll hear it referred to as genesis. You'll heard it or pronounced both ways. So what about, we haven't learned this term, but I'll teach you. Carcinogenic. Anybody heard that word before? Something is a carcinogen. Anybody know what that means? Anybody heard that word before? No, not carcinogen. Carcino means cancer. So if something like cigarettes are a carcinogen, what does that mean? Gin,
They
produce cancer. So something that's a carcinogen causes or produces cancer. Don't really produce it, but it causes it anyway. Gram can mean picture, and right on here put /record.
Instagram.
/record. So it can be a picture or a record. So what about an electrocardiogram?
Electric heart picture.
It's a picture of the heart on the computer or whatever.
Okay, an electrocardiogram is a picture or record of the electricity in the heart. So how the heart is conducted. Have y'all ever had an EKG done? Electrocardiogram is the long word for EKG.
I learned what that was the other day on Untold Stories of the Universe. Good stuff.
So, anyways, but that's what they look at. They hook all those electrodes up and they actually look at how the electricity is moving through the heart. An electroencephalogram, an EEG, is where they actually look at electricity in the brain. Encephalo is the brain. And then last is malacia, and this is softening. So what if I said osteomalacia? Or chondromalacia. Chondromalacia.
Softening the cartilage.
Softening the cartilage. Good. Okay. Okay, y'all smarty pants. Go. Okay, so we'll have that on Thursday. If you do not have the weekly page, I have some. Make sure you get it. And we'll have this on Thursday.
Teachers and students, participants in a